Okay, welcome everyone. Hope everyone's doing well. Welcome. This is the Homeopathy in Action series, and tonight's session is with Dr. Mitchell Fleisher. So I'm going to introduce Dr. Fleisher. He's going to give a presentation for about an hour, and then I will be giving a shorter presentation for about 20 to 25 minutes, talking a little bit about the presentation that Dr. Fleisher gave, as well as doing a little materia medica of a remedy. So let me go ahead and introduce Dr. Fleischer. I've got a piece of paper here that I'm reading from. It's fairly lengthy, so I won't read the whole thing, but I'll just start. Dr. Fleischer is a double board certified licensed family physician specializing in anti-aging, regenerative medicine, peptide therapy, exosome and stem cell therapy, advanced muscular injection therapy, constitutional homeopathy, nutritional and botanical medicines, IV therapy, chelation, and detoxification therapy, biooxidative therapy, and bioidentical biomimetic hormone replacement therapy, with over 30 years experience practicing the gentler art and science of integrative medicine. And then the page goes on forever describing all of his teaching positions, the books that he's written, his his work at for different conferences. It goes on and on and on. But the bottom line is, for me, let me just share a story. I have a very good friend of mine who a few months ago started experiencing severe muscular weakness. It just came on overnight. He was exercising and just like within a few minutes, he developed this tremendous weakness. He's so weak right now that he literally can't turn over in bed. And when this happened, he called me, and of course, it's a very serious condition. He needs to get lots of medical testing, and he asked me, "What would I do if I was in that situation?" And my response to him is, "I would go and see Dr. Fleischer." And the reason I would do that is because Dr. Fleischer is a real doctor. He is somebody who became a physician not because he wanted to make money or be famous. He became a physician because he has a burning desire to help other people, to heal, to use whatever talents he has to help people feel the wellness of life, to feel fully alive and to embrace the world around us. And that's what motivates him. And also, he's incredibly knowledgeable. And even though he's a fully trained medical physician, highly trained medical physician, he chose to employ natural therapeutic methods because he understood, like the founder of homeopathy, Samuel Hahnemann, understood that these conventional approaches oftentimes are very damaging and sometimes don't offer solutions for problems which homeopathy and other natural therapeutics do offer solutions for. So for all of those reasons and much more, Dr. Fleischer is somebody I'm proud to call a friend. I respect him tremendously. He's one of the most brilliant homeopaths on the planet. And you'll see through his case presentation the ability he has to really help people who have very, very serious health issues. So, Mitch, welcome. Thank you for being here. I'm going to stop sharing, and you can go ahead and share your screen.
Well, I'm going to do my little introduction preface first. And I appreciate that introduction, Kim, and I'm trying to prevent my head from exploding. But I really appreciate this opportunity to share with you all. And I've chosen one of my more unusual cases to share with you because it's something I learned a lot from as well. Well, before I begin, I'd like to offer a brief clarification about my approach to homeopathic medical practice. I am first and foremost a Hahnemannian classical homeopathic family physician. I believe that the foundation of sound homeopathic practice is rooted in the organon and in the classical teachings of masters such as Berningshausen, Hering, and Lippi. And while a classical Hahnemannian homeopathic approach has been profoundly effective for very many of my patients, there have been cases in my practice for which it did not bring full understanding in the anamnesis or the remembering of case taking, nor the expected therapeutic resolution. In service of these more challenging cases, I began to explore additional approaches, methodologies, homeopathic case taking and case analysis, always grounding them in and testing them against my understanding of fundamental Hahnemannian homeopathic principles. Some approaches proved useful, others did not. However, the sensation method of case analysis had shown itself to be a powerful tool in certain difficult cases. Today's presentation will demonstrate how this method can be applied in a complicated case and provided profound relief. Well, I'm going to open up let me see, open up the PowerPoint, and then I will share my screen. Here we go. And click here, and then I will share the screen and share. And let me start this. Slideshow. All right. One of these things has got to activate it. This is on my new computer here. It doesn't want to open.
Hey, Mitch, if you could, I think you should make that window larger by clicking on I think it's the green button
I
or the
am. I'm trying to open. Oh, here. Where's the start this slideshow? Play from start. Here we go. There we go.
Okay, great.
There we go. All right. So this is a case of severe suicidal depression solved and cured by the sensation method. And this is a case that was first seen in 2005 of a 28-year-old white female who had been followed in my homeopathic family practice since 1993. And over the course of the previous 12 years, she had been treated successfully for various disorders, including severe dysmenorrhea, which is menstrual cramps, metrorrhagia, which is heavy menstrual bleeding, premenstrual syndrome, PMS, anxiety, reactive depression, dysthymia, which is chronic negativity and sadness, chronic allergic rhinosinusitis, urticaria, which is hives, acne vulgaris, tension headaches, constipation, and herpes labialis, or cold sores, with various potencies of Lycopodium clavatum, Ignatia amara, Aurum metallicum, and Natrum muriaticum, with good responses to all of those remedies. The patient was taking oral contraceptives to prevent an unwanted pregnancy, but fortunately refused to take other allopathic drugs. She was also, unfortunately, very non-compliant with nutraceutical and dietary therapy. She wasn't very good at taking care of herself, unfortunately. In July of 2005, she presented via phone consultation with a complaint of the worst depression she'd ever felt. She'd moved from Virginia to London to live with her new boyfriend, who was a struggling artist. She couldn't find a job in London and was feeling bored, frustrated, very frustrated, in fact, and lonely in their small, dark, bleak apartment in London. Her boyfriend spent most of his time away working on art projects, and she had no family or friends in the city with whom to socialize. And she had a lot of fears of the relationship not working out as she desperately desired. So I asked her, "Tell me about your fears." And she said, "I don't have control over anything. I have no backup plans. I feel down, lost, scared because I have no plan B, but I want plan A to work out so badly, or I'll be crushed. I feel lazy, very unproductive, which I hate, and I spend all day crying uncontrollably at home alone." She also complained of lots of blackheads and cystic acne on her face, especially her chin, and irregular menses, which became worse after starting oral contraceptives. I asked her, "Tell me more about the crushed feeling." And she replied, "I have nothing. I'm so unhappy. I have no options. I won't make it. I'll be miserable. Everything will go wrong. Nothing good will ever happen again. It kills me." And she said that quite often. I asked her, "Tell me more about this, please." And she said, "The negativity is killing my spirit. Hearing inside, no, I can't do it. It won't happen. It's impossible. I won't get a job in the UK as a US citizen. I'm at the bottom of the pile. There's no chance, no help." She said, "I feel completely at the end of my rope, and I had panic-driven depression, and ugly suicidal thoughts. And these are all her exact words, which is very important in case taking. There were bomb threats in my London neighborhood, and I was totally shocked and more depressed, stuck at home. I asked her to describe more about the feeling shocked. She said, I feel suffocated, not in control, can't see any way past it. I feel frozen in this awful emotion, just lay here and get smashed by it. I'm just shocked and frozen in this place. I don't even try since I'm so afraid that it'll get worse. I'm really frustrated and annoyed with myself. I asked her, please tell me more. She said, the hopeless despair puts me into a panic attack sometimes. It gets worse at night. I gasp for air, take deep breaths. I feel totally paralyzed. I can't leave home and go outside. I just want to crawl into a hole. I just want to hide. She also complained of feeling ultra sensitive to everything. She couldn't stand watching TV or being in crowds or any loud noises. She couldn't tolerate bright lights or strong odors. They drove her crazy, and they made her feel very irritable and even more intensely depressed. When I inquired further, she stated that she did not blame anyone else for how she felt, not even her boyfriend, who had often left her all alone in a strange city with no real support. Rather, she believed her terribly painful state of mind was a result of her own lifelong oversensitivity and tendency towards despair. Since she had responded very well in the past to Ignatia, she was given a 1M potency, but there was no effect at all. A subsequent dose of Ignatia 10M potency also failed to act, and her depression worsened. Further inquiry did not indicate aurum metallicum or any aurum salts, nor natrium muriaticum. So I realized I had to try a different approach to understand her. Using kingdom analysis from the cessation method of Sankaran and others, it was clear that her core issues were sensitivity and reactivity, which is consistent with the plant kingdom. She did not display the core issues focusing on one's structure and function, which indicate a mineral remedy. Nor does she have the core issues of self versus other, victim versus aggressor, superior versus inferior, and or blaming others that are typical of an animal remedy. The plant remedy themes of frustrated, crushed, shocked, suffocated, paralyzed, frozen in place, and beside oneself with grief and anxiety are consistent with the Loganaceae family. This is a very large family, a lot of which is from Southeast Asia. The experiential themes of hopeless despair, no options, feeling like everything is going wrong, nothing good will ever happen, negativity is killing my spirit, and ugly suicidal thoughts were consistent with the syphilitic miasm. It was clear now why Ignatia did not act, since it's classified in the cancer miasm within Loganaceae family. And cancer miasm is one of issues of control and a loss of control. The Loganaceae family in the syphilitic miasm is Hoan Nang, or Strychnos gotheriana. A review of the available homeopathic materia medica revealed that Hoan Nang is a plant indigenous to Tonquin, China, whereas a greater reputation as a remedy for leprosy, hydrophobia, snake bites, and diseases of the skin. In 1883, approval was made by 7 persons, and a few representative symptoms were produced. According to Hansen, the symptoms were prurigo. Prurigo are these very, very itchy, hard nodules, pustular eczema in parts, well supplied with sebaceous glands like the face, neck, and genitals, boils, furuncles, and carbuncles, constitutional syphilis, cancer of the glands, and general malnutrition were also met by this remedy. The recommended dosage, and Berkey's and other homeopathic books, is 5 to 30 drops of the tincture 3 times daily. They were giving it in a material dose. And the materia medica of Hong the only recorded mental symptoms are mental lassitude and indisposition to effort. And she had those to a great degree. The indisposition was very clear, but there was a lot else missing. Therefore, it was not possible to ascertain this remedy via the classical Hahnemannian method by repertorial analysis. Of course, nor was any, I couldn't make a careful comparative study of the materia medica because there were so few symptoms that were recorded. So I made the choice to prescribe the patient a single dose of Hoandong 1M from the Quinn Pharmacy, Hahnemann Pharmacy in California, taken dry on the tongue on July 25th, 2005. At the first follow-up, she was seen in person for follow-up on January 12, 2006, having broken up with her fiancé and returned to the US. She stated that she felt stronger, more decisive, and less depressed after her remedy, but now feels that the stress of breaking up and coming home to the US and living with her critical parents has antidoted her, and I treat both of her parents, and they are indeed quite censorious people. She feels very sad, crying all the time, panicky, trapped by her feelings, suffocated, scared of never working out with her boyfriend, having to be on her own, and hopeless despair. She's back into the syphilitic miasm. She wakes up terrified in the morning and doesn't want to deal with the day. Her biggest problem has been indecisiveness, is a resolution, fear of making the wrong decision, that something's going to make her more miserable. She has anxious dreams of going to a strange wedding, and then chaos happens. Men in black burst in and shoot at her with machine guns. She hides her eyes, terrified, knowing that she'll be killed. Very strong feelings here. And this is where we can use dreams to pull out unconscious feelings that are clear. They help to clarify the overall constitutional mental emotional state. I asked her to describe more about trapped. She said, I feel trapped in my indecisiveness. I can't move. Hard to take a deep breath. I just can't do anything. I also feel trapped by depression, my anxiety and panic, and also by deep grief and hopeless sadness. There's no way out, no solution, nothing will help. If my plan does not work, I feel intense disappointment that incapacitates me. You can see how deep the syphilitic miasm is. I'm absolutely shocked and crushed that my plans didn't work out. I'm scared to do anything from fear that it won't work. I feel so frustrated, sad, and angry. The Loganacea are very irritable, angry remedy types. So the second homeopathic prescription, she was prescribed another single dose of Hoandong 1M, taken dry on the tongue on January 16th, 2006. At the second follow-up, she was seen in person on July 6, 2006. I observed that she appeared much calmer and healthier. And, her eyes were brighter. He was just, chill, much more than she'd previously had been. And she stated, I feel really good since the last remedy. I live a privileged life, and it was a struggle to find myself at the breakup, but I did. My boyfriend called me and said that he wanted me to come back to England, but I decided to stay home and finish my postgraduate program in Darden, which is the UVA, University of Virginia School of Business, a very good school. So you can see her decisiveness, her resolution had improved after the remedy. I love being in charge and making things work better. This is actually the healthy state of a Loganacea remedy, of the syphilitic state. This is the compensated state. I'm really enjoying it. Since she was doing quite well, she was prescribed a placebo remedy, just given with some lactospilules. She decided to have breast enhancement surgery and had silicone gel implants placed on May 21st, 2006. She took Arnica 30C on her own pre and post-op. Since the surgery, she's been feeling somewhat trapped by indecisiveness again, fearful of getting married and having children until she's made the commitment. This is much like Nux vomica, which is also in the Loganacea family. She decided to stay on birth control pills until she possibly gets engaged to her boyfriend in a few months, though they though they cause irregular spotting and actually worse dysmenorrhea. And she might move back to England. She was prescribed a single dose of Huanong 200C for the partial relapse postoperatively, which was taken on July 12, 2006. She was also advised to wean off the oral contraceptives, mostly because they were making her worse and they were uh, imbalancing her hormones further. She was seen in person for follow-up on November 1st, 2006, at which time she had been feeling very well until recently. She had been under stress since deciding to move back to the UK to become engaged to her artist boyfriend. She stated that she was feeling nervous, panicky, had trouble sleeping, felt stressed out dealing with her family. She also was having acne and herpes flare-ups around the lips, and more PMS and wondering if she's hormonally out of balance, which she was. She never discontinued the British birth control pills despite its ill effects. So the fourth homeopathic prescription, she was given a single dose of Hoanong 1M, as well as placed on a 6C daily, begun on November 16th, 2006, because of the antidoting effects of all the stress and the British birth control pills. She was strongly advised to wean off the birth control pills and use safer contraceptive methods that would not disrupt her hormonal system and interfere with her remedy. At the fifth follow-up on March 8th, 2007, she presented with her follow-up via phone consultation. She stated that she'd been feeling really well after her last remedy, really balanced, even under the stress of moving back to the UK, getting married, and then moving again to Spain with her husband and starting a new career with a family business. She had discontinued the birth control pills in late November 2006 and finished the Hoanong 6C pellets. Then there was an interim phone follow-up. In January 2007, she explained that her anxiety, depression, PMS, acne, and herpes were all much better. Her skin was clearer than it had ever been. Even her libido was stronger, which was unusual for her. And she was given reassurance and encouragement. In late February 2007, her new husband, who had been depressed about his career as an artist not going well in Spain, committed suicide by hanging himself in the bathroom. And the patient discovered him there. And she felt shocked, frozen, paralyzed, couldn't move, confused, didn't know what to do, as if the rules in her head had been broken. A line had been crossed, and she just wanted to disappear. She repeated that she felt completely and totally shocked and disappointed to the point where I feel suicidal and have suicidal thoughts. But I'm so shocked that I just sit there on the bed with my mouth open and can't scream or move. Back into that deep syphilitic state. Her parents arranged for her to promptly return home to Virginia for recuperation and grief therapy, which she began in early March 2007. She received another single dose of Hoanong 1M and 6C pellets daily, which were begun on March 10th, 2007. She missed her follow-up. In August 2007, her mother, who was also my patient, related to me that her daughter recovered relatively quickly from the shock of her husband's unexpected suicide, which is quite unusual, and did very well after the last remedy. Her mom said that she had moved to California to live near her sister, began a new job there, and had a new love interest and was feeling balanced and happy overall. The second interim follow-up, at her mother's rare follow-up herself, in December of 2015, I inquired about her daughter. Her mom shared that she'd remarried, had two healthy children, was very happy and balanced, and no longer had ongoing issues with severe anxiety or suicidal depression. I asked her mother to convey to her daughter my very best regards and to let her know I'm still here if she needed homeopathic care. And that if she ever visited Virginia again in the near future, to please kindly call and let me know how she's feeling. As fate would have it, in January 2021, she relocated to Virginia with her new husband and two children to be near her elderly parents. Soon thereafter, she brought her youngest son and daughter into my homeopathic family medical practice for constitutional treatment. Subsequently, her son has done very well on arsenic amalgam and carcinosinum for his severe social anxiety, and her daughter on sulfur and ascending potencies. They're both very adorable children. The daughter's a real spitfire. Their young mother is feeling very well and healthy without any return to the Hoanan state and has not yet needed a new simillimum in all this time. And I have been seeing her, I most recently saw them about 2 months ago, and she's still doing fine. Hasn't needed another remedy. Well, the new Materia Medica Hoang, according to Sangron, it's Loganaceae plus the syphilitic miasm. The repertory extraction of generals for this remedy showed cancer and syphilis in the third stage. In the skin, leprosy is also seen. In the map of the miasms, syphilis lies at the end of both cancer and leprosy. If reference works is searched using syphilis, many references are given to Annam. In the mind section of Clark's dictionary, it says mental lassitude and indisposition to effort. This is an attitude of having given up. So Sankaran assigned the remedy to the syphilitic miasm. Loganese summary that you have both a passive and an active reaction in the sensation method. The passive reaction of the Loganese is a feeling of being paralyzed. You cannot move. You feel trapped, suffocated. You cannot weep. You're faint or faintness. The active reaction is one of being very excitable, frustrated, irritable, angered easily, especially something like nux vomica, beside oneself with anxiety and stress, crying uncontrollably, cramps and spasms. All the Loganese can have that. It's particularly strong in nux vomica, and seizures of different sorts, and convulsions. The sensation keywords in a decompensated state, when someone's really ill, you'll find them saying things like they're splitting apart, they're coming apart. These are actually the words that the patient is using. That's why it's important to record exactly what they say. So they feel like they're splitting apart, coming apart, scattered, fragmented, divided, cut off, pulled off, not together, separate, divided, severed, breaking into many parts, separating into many parts, falling apart, disconnected, unconnected, loose or looseness. They fall into pieces. They're apart, disjointed, disconnected, detached, unattached. They're taken apart. They break apart, ripped apart, tear apart, cracked, they break free. They're untied, disengaged, all over the place, disunited, spread in many directions, and disseminated. So if the patient uses any of these words, it gives you a hint that this is the Loganacea state. The sensation keywords in a compensated state too, when they're doing better, and they feel together, they feel bandaged or bound up or binded, bound together, attached. They feel attachment with others in relationship, bonded, connected, or this connection, joined. There's this joint between other people and themselves. They feel linked. They feel union, whole, wholeness, wholesome, contained, put together, tied, and united. So it's just the opposite feeling in compensation. So essentially, what you see in the compensated state is calmness. They're composed. They're calm and composed in the most shocking circumstances. And that's basically this case. If you have any questions, I'd be happy to answer them now.
Yeah, Mitch, there are some questions in here. Please feel free to type any questions you have into the chat box. So, first question here is that one of the participants asked is why was the follow-up to her appointments and remedies several months in between and not sooner?
Well, first of all, the patient missed a lot of appointments. They'd call and reschedule on a regular basis. You can only just do so much, but you have to let the remedy act too. And when you're doing a deep acting remedy, I usually give it at least 6 to 8 weeks, if not longer. But she also rescheduled a lot of her own appointments. And then after she got better, she disappeared. She moved off to California, and I didn't hear from her again for many years, except through her mother, to her family. But that's
exactly.
not unusual in clinical practice. You see that happen a lot.
Yeah, yeah, for sure. Um, how long was she given the 6C for, Mitch?
She was given a 2 gram vial, and I told her, and this is the instructions I give. You can take a daily dose until you feel like you don't need it anymore. And the patients often they stop it on their own accord when they're feeling better. But I explained to them it's just to give you a little kick in the presence of stress or when you're on drugs that could potentially antidote the remedy. So I educate my patients really well. Patient education is extremely important, and I let them know how they can use the daily dose um, to their own benefit. And in many cases, I often give the daily dose in a liquid potency, a 6C in water. In her case, the reason I gave pellets is that she preferred them. She didn't like she didn't want to go to the trouble of taking the remedy and succussing and taking liquid. So I just gave her what she would wind up being compliant taking.
Thanks, Mitch. Mitch,
Mhm.
a few people have been asking about the name of the remedy because it's obviously not a well-known remedy, not one
Yes,
that people are
it's not at
particularly
all
familiar.
well known.
Can you give the common name, the Vietnamese spelling of it,
Okay.
and but
It's
also give the Latin name spelling so people
yeah,
can find it?
yeah. It's Hoan, Hoang dash Nan, Hoan, and it's actually the Latin genus is Strychnos gotheriana. That's Strychnos, Strychnos. Which the family, it's the strychnine family, essentially, the strychnine alkaloids. Nux vomica, strychnos nux vomica in that family, a lot of them. And Gaultheriana. It's Gaultheriana.
Thanks, Mitch.
You're
Somebody
welcome.
asked here if you feel the contraceptive pills were part of the cause of her symptoms.
Not the only symptoms that were really causing her is worse acne, an aggravation of her typical cystic acne, and a worsening of her menstrual cramps and uh, the dysmenorrhea and a little bit of irritability. But a lot of those symptoms existed prior to her being on birth control pills. That irritable nature she'd had for many, many, many years. She had sort of inherited it from her mother and father, especially her mother. Um, but I don't think the birth control pills played much more of a role than in upsetting her hormonal balance and giving her some more PMS and acne. It didn't really create the suicidal depression.
Thanks, Mitch. Somebody here asks, a person writes, classically in many homeopathy schools, it's been said that the lower potencies antidote the higher ones. What is your opinion about this?
I don't think that's true at all. Um, in fact, I know that's completely wrong after 45 years of practice. Haven't heard any. I've actually, in all the schools I've ever taught in or been part of, I've never heard that said before. That's really unusual. Um, it depends totally on the clinical situation. If someone is not on allopathic drugs and they're eating a fairly good diet and they're not doing a lot of things to interfere, I often will just give a single dose. Or if they're really in an upset state, I may give them a kickstart of a lower potency of like 30C once a week for a few weeks, or 200C 3 doses in a row, or 1M once. But if they have antidoting influences or are under unremitting stress that's going to um, put a lot of pressure on the remedy acting in their system, I'll put them on a short course of a daily dose to support their system and let them know when they're feeling better, they can stop taking it. But I've never seen a low potency antidote a higher potency in my career.
Thanks, Mitch.
Hmm.
So, a lot of people are not familiar with the vital sensation method, and so a number of people have asked if you could just basically explain how this method actually works. Like, what is the general, just approach that is used? How do you arrive at the remedy using the sensation?
Okay. Well, as you noticed in my case taking method, I ask open-ended questions. to allow the patient to express themselves. And I don't interrupt while they're sharing. I just prod them to tell me more about what they're feeling. And if they bring up a very strong keyword or a theme, I'll ask them about it and just have them express themselves. But what I'm looking for is any strong sensation, symptoms, any strong sensations that they keep on repeating throughout the case, whether it's, especially when you see it expressed for physical symptoms and emotional and mental, then that energy of that theme runs through the case. And you definitely want to have an understanding what they actually mean when they're saying that. What are they actually experiencing? And in some cases, I'll have them, I'll use a technique that Divya Chhabra has used of free association, where I'll have them just close their eyes and relax, and I have do them some meditative breathing to just clear their minds. And I'll tell them to think not of anything that's happened in their life, is happening, or ever will happen. Not, I tell them not about you, and I'm going to drop a single word in there and let their mind go free, and whatever comes up spontaneously, just speak it out and follow with that. And I'll just mention one of the sensations, the words that they used in the case taking. And it's amazing with the images that they'll come up with. And then you follow that even further and to go deeper into the sensation. So the idea of the sensation method is that this came up from the analytic approaches of Sankran and his colleagues in India, where when they looked at materia medica of uh, remedies in a particular family, a plant family or different uh, elements or salts of elements, they wanted to see the key themes that ran through all of these remedies within the family. And if there was an association between the different ones. And this is what they found when they look at the Loganaceae family, and when you look at the Ranunculataceae family or the Solanaceae family, you'll see that there's certain key feelings and sensations that run through all of the remedies in varying degrees. And um, the miasms and the way in the sensation approach, the way they think of it, whether it's the acute miasm or the psychotic miasm or the syphilitic miasm, it's actually the intensity or pace of the disease process. And so on one hand, it's acute, they're sudden and intense, they're panicking, but they're going to get over it, usually. And the syphilitic end is this feeling of destruction, and everything's falling apart and they're getting killed. So there's a whole range of pace and intensity. And so that's what defines it. So what you want to find is which remedy in the family that has all of those peculiar sensations unique to that family, what's the pace and intensity that they're experiencing those sensations? And that'll help give you the remedy. And sometimes there's more than one remedy in um, a given miasmatic state, and then you want to explore the materia medica to differentiate them. But in this case, there was only the single remedy, Huan in the syphilitic miasm. And despite my intention to try to repertorize it, it was unrepertorizable. So I tried this approach, and thank you God, it worked. You live and learn.
Love it. All right, Mitch, somebody asks here, during the time period indicated, are you aware if she was receiving any mental health treatment, especially when she was feeling suicidal?
She was reluctant to do that until she came home. She didn't get any when she was in Spain or the UK. But when she came home and stayed with her parents, she saw a psychotherapist that I recommended to her just to be able to have someone to express her feelings to, because her parents are not the kind of people that she could never really trust them to share her feelings with because they would use her against them and manipulate her. Not a good situation. So I got her into therapy just to be able to emote and express herself and reflect back. And actually, I do a lot of that with my patients in the practice too. Very much, you can use homeopathic case taking as a means to help someone understand themselves. Hahnemann called it homeopsychotherapy, in which you take the case And once you've gotten the whole case and you really grok it, you really deeply understand it, what I often do is I'll reflect back to the patient what I believe I understood about what they were experiencing. And very often, when you are right on, you've hit it, their eyes get really wide, and it's like, yeah, 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 yes. How did you know that about me? And if it's well-known materia medica, you can often ask them questions about the materia medica of the remedy that you think they need, and when they respond in the positive to it, it's just more confirmation that you've got the right prescription. But basically, reflecting back to the patient their experience um, raises their self-awareness, which also raises their consciousness, which is in and of itself therapeutic. So that can be a very helpful process for patients.
Thanks, Mitch.
You're
Somebody
welcome.
asked here, do you feel that the remedy also helped with the snake bite that was mentioned at the beginning of the presentation?
Well, I've never used it for snake bites, but in the materia medica, I think Burkes and Fataka and others, they mentioned that it was used in snake bites, but I personally have not prescribed it for that because
Okay,
there's no it doesn't give you any specific indications, whereas I prescribed Lachesis and Crotalus horridus and other remedies like that for snake bites because you have more definitive materia medica to prescribe it. But and they also were using it in almost a mother tincture form for snake bites. Um, I wish there was more information in that regard, but it is interesting.
thanks, Mitch. So somebody here asked, she made such a great recovery. Was there any cognitive behavioral therapy as well? Wonderful case. Thank you.
Uh, she got regular psychotherapy, not so much cognitive therapy. And she only went for a couple of sessions because she was feeling well enough to be on her own. Her remedy type tends to be very independent. The Loganacea like to do it themselves. And so when she was feeling better after the homeopathic treatment, um, she didn't continue with any therapy.
Thanks. Mitch, somebody asked about, I think at one point you gave a 1M and then I think you repeated the 1M, and somebody asked why you didn't go up in potency at that point.
Because there weren't any indications that she needed a stronger remedy at that point.
Okay. Someone says, how would you approach someone who is in a shutdown state but is nonverbal and can't express themselves?
Well, you observe them as best as you can, and you also get a history from anybody who knows them, who's been around them, from the family or friends, and for just from direct observation. You know, it's not uncommon to have to treat someone in a coma, or it's like treating someone in a coma or an animal. They can't tell you the case. You just have to observe and do the best you can. Now, a remedy like Hoan Nang, you're probably not going to get just from just observation alone, unless you knew something about their previous history. The fact that she had responded in the past over the previous 12 years of training her to Ignatia Amara wonderfully gave me an idea of what family her remedy type was probably in. So
Fantastic.
that made it somewhat easier to go deeper into her case.
Fantastic. Mitch, I think maybe what we'll do now is there's still a lot of questions here, but a lot of them are similar. So I think maybe what we'll do is I'll do my presentation. This will give people an opportunity to ask more questions. I know you're going to stay on, and then we can address any further questions that come down the road. Does that sound okay with you?
That sounds great.
All right. So all right. So I am going to show my camera. All right. So here I am. Need a little quaffing, but that's okay. And let me go ahead and share my screen now. All right. So thanks, Mitch. That was a great presentation and remarkable results. It's always nice to see the power of homeopathy in action. So I prepared this presentation basically after reviewing Dr. Fleischer's presentation. So I'm addressing some of the issues that are coming up. And the first question really is that I wanted to ask in my presentation is what is a simillimum? And for those of you who are homeopathic students or practitioners, you know that the simillimum is the remedy that most closely matches the symptom pattern of the person that you're working with. But we could go a little bit further and say, is the simillimum just the best remedy from the list of available medicines that we have, those that we have done provings on, that we have clinical information about? Or is the simillimum the best remedy from everything that exists in nature? Because there's so many different living organisms, plants and animals and minerals and noble gases. There's all kinds of things in nature which could potentially be made into a homeopathic remedy. So the question is a simillimum the best remedy from the list of available remedies that are in our materia medicas and repertories, or is a simillimum the best remedy that could exist anywhere in nature? I think this is an interesting question. Now, when we look at the remedies in our literature, in our materia medicas, and in our repertories that are coming from nature, we see, for example, that with regard to the snakes, the serpentis, that there are about 3,600 species in nature, but we've only got 30 in our materia medica. The arania or spiders, well, there's 45,700 species of those, but there's only 22 in our materia medica. The solanaceae, 2,700 species in nature, 45 in our materia medica. Apiaceae, 3,700 species, only 36 in our materia medica. And then you've got a fairly larger grouping, what used to be called the Compositae, which is now called the Asteraceae, with 32,913 species, but only 75 in our materia medica. And then you've got the Orchidaceae, which I think now is up to maybe closer to 50,000 species, but there's only 8 in our materia medica. So you can see that our sampling rate from all the possible things in nature that could be homeopathic remedies is very, very small. As a matter of fact, there are 620 different botanical families that exist in nature, and only 40 of them are represented in our materia medica. And that doesn't even take into consideration where the particular substance is found, because maybe a chamomilla plant growing in Holland on different soil composition than one that's growing in New Jersey might have a different medicinal effect on you. So the particular plant, where it's growing or where it's found, may impact its medicinal effects on a living organism. Or what part of the plant is used. Are you using the root or the leaves or the flower? Each of these has different chemical compositions and alkaloids and may potentially produce different medicinal effects. So the possibilities from nature are infinite. And if a simillimum is defined as the best remedy for everything that exists in nature, you're never going to find it because there's just so many different possibilities. Maybe your perfect remedy is a orchid that just went extinct in the rainforest. Sorry, it went extinct. You can't be helped with homeopathy because your remedy is no longer in existence. Well, it would be impossible to practice homeopathy if this was the situation. So in reality, the law of similars is forgiving. You can give a number of different remedies that are close enough to stimulate the life force of the person receiving the remedy to produce a response and move that individual towards a state of greater health. The law of similars is forgiving. And the truth of the matter is, we don't really give simillimums, as my colleague and friend Dr. Taylor used to say, we give what is called close enoughificums. And as long as it's close enough and your body responds to it, it produces certain reactions, and that begins the healing process. Fortunately, Hahnemann was aware of this particular issue, this particular problem, and he addressed it in his very seminal work called The Organon. The Organon der Heilkunst is essentially the organon. The very first organon was written by Aristotle. Okay, and organon, the word means instrument or tool. So organon der Heilkunst means the instrument or tool of the healing art practitioner. And in a particular section of this book, which is essentially the Bible of homeopathy, the book, the textbook that tells you how to practice homeopathy, and it's written in an aphoristic style. So there's particular aphorisms. In aphorisms 162 to 172, Hahnemann addresses the issue of a lack of available medicines. Because at the time that Hahnemann, the founder of homeopathy, is practicing in the 19th century, he only had about 125 to maybe 140 remedies. So there would be situations where he didn't have a perfect remedy, a perfect simillimum that would cover the totality of characteristic symptoms in the case. And this particular section of the organon addresses that issue and tells you how to deal with it. Basically, what it says is that you may have to give an imperfect remedy, which will take away some symptoms. New symptoms may arise. You're forced to retake the case, and you could look at the new symptom pattern, and based on that new symptom pattern, you give a different remedy. And you just basically proceed in this manner, giving a series of remedies over a period of time to finally resolve and address the situation. This was Hahnemann's particular approach. Now, of course, if we have more remedies, we can resolve these situations more quickly. For example, when apis was introduced into the materia medica, apis is the honeybee, it's a crushed honeybee. When apis was introduced into the materia medica, many practitioners said, oh, here's this wonderful remedy that will basically replace us having to go back and forth between sulfur and arsenicum. In previous cases, you had to go back, zigzag back and forth between those two remedies because apis didn't exist to cover those cases more fully. So this is the approach that we use in homeopathic practice. And this approach has proven itself to be incredibly effective. I'm showing you here a school called the Homeopathic Medical College of Pennsylvania. It was established originally in 1848 by Constantine Herring, Jacob Jeans, and Walter Williamson. It wasn't a particularly good school in its early years, but in 1864, it was taken over by Adolf Lippe. Lippe took control of the majority of shares in this particular institution. Constantine Herring got very upset and angry. He left. And Lippe, from that moment on, decided to teach everything according to a very strict Hahnemannian point of view. And what's amazing, and what we now have in the documented record, is that the people who graduated during this period of time between 1864 and 1869 were the most successful homeopathic practitioners. We know this, it's in the documented record, there's no question about it. So, adhering to the principles described in the Organon and Hahnemann's other writings certainly does create a certain level of success in practice. And I, like Dr. Fleischer, have been Hahnemannian homeopaths, what we sometimes refer to as a classically trained homeopathic practitioner. But there are cases, we all have cases where we don't succeed, where we have failures. And it's important to recognize this thing called confirmation bias. What is confirmation bias? Well, confirmation bias is the tendency to search for, interpret, favor, and recall information in a way that confirms or supports one's prior beliefs or values. In other words, just keep finding things that support what you already believe. And if something comes along that conflicts with that, well, just disregard it altogether.
It's cognitive consonance.
Yes, exactly. Exactly. Now, this particular sentiment was very well expressed by Friedrich Schiller, the poet of freedom. He's essentially equivalent to Shakespeare in the English language for the German language. He was the poet of freedom. He influenced the American Revolution. He wrote the Wallenstein trilogy and the Maid of Orleans. Great playwright, great poet. And when he was lecturing at the University of Jena, he gave this presentation entitled, What is and to what end do we study universal history? These slides will be posted for everybody so you can review these at a later time. They'll be available to everybody. But I just took an excerpt from this to give you the sense of the sentiment that we should all engage in life, the sentiment that doesn't keep us rigid, the sentiment that always embraces what is new so that we grow and learn and become better and can help more people in a better way. So here's the passage from this lecture. Schiller wrote, New discoveries in the sphere of his activities, which cast the bread-fed scholar down, delight the philosophical mind. Perhaps they fill a gap which had still disfigured the growing whole of his conceptions, or they set the stone still missing in the edifice of his ideas, which then completes it. Even should these new discoveries leave it in ruins, a new chain of thoughts, a new natural phenomenon, a newly discovered law in the material world overthrow the entire edifice of his science. No matter, he has always loved truth more than his system, and he will gladly exchange the old insufficient form for a new one more beautiful. In other words, we should be neophiles and not neophobes. We should always be looking for greater truths. When we, as human beings, try to understand truths in the universe around us, we create what are called models. But models are only an approximation of truth, and we can always improve upon our models so we can better describe the universe around us. This is essentially what Einstein said or communicated when he wrote, "A man should look for what is and not for what he thinks should be." So let's talk about this issue that Dr. Fleisher brought up in his case, which is the issue of groupings in homeopathy. The idea that we don't look for an individual remedy, but that we first try to identify a grouping, because in that grouping, the remedies will share certain similar symptoms. They will have, as Dr. Fleisher mentioned, a theme which ties them all together. Now, there are many different types of groupings that we find in homeopathic practice. We've got kingdom groupings. This would be groupings of remedies in the mineral kingdom, in the plant kingdom, in the Monera or bacterial kingdoms, in the imponderables, things like lights and X-rays, things of that nature. So there are many different groupings. Kingdom groupings is one. We can have specific botanical groupings, like the Solanaceae or the Apiaceae or the Loganacea or the there are many, many of these, many antheas, many, many different groupings. You can also have zoological groupings like the Arania, which are your spiders, or the Sempentes, which are your snakes. You can even have groupings within the context of the periodic table where you can look at remedies in the stages. You've got the 18 different stages across, and you could look, for example, in stage 15, and you could see remedies like arsenicum and phosphorus and antimony and bismuth. And interestingly enough, all of those remedies in stage 15 all have a very strong affinity for the stomach. And interestingly enough, bismuth and phosphorus both share a very interesting symptom where they desire cold water. They drink that cold water, it warms up in the stomach, and they throw
And
it
they
back up
throw it
again.
out.
Yeah. So we know that there are definitely concordances or correlations between symptoms in the stages. And then Jan Scholten has advanced it even a little bit further by even looking at the series. So remedies that are in the Ferrum series or the Aurum series or the Argentum series can be grouped potentially together based on similar symptoms. And then you've got what are referred to as miasmatic groupings. And there are many other groupings as well. There's groupings based on facial characteristics and colors and different ways that we can group our remedies together based on some similar idea. Now, my question, of course, about all of this is, you know, are there advantages to doing this? Are there disadvantages to doing this? Is this something that Hahnemann ever talked about? Now, when I ask my students this question, oftentimes I get a response, well, no, I don't think Hahnemann never talked about this. But the actual reality is that Hahnemann did discuss this particular issue in an essay that he wrote in 1796 called In Search of a New Principle for Discovering the Curative Power of Drugs. This is a very important essay. It's the essay where Hahnemann first put pen to paper and wrote down similia similibus currentur, like cures like. Remember that Hahnemann did his original proving of cinchona officinalis in 1790, but because he always embraced, being very, very careful about what he shared, doing due diligence, he tested the theory of the law of similars for 6 years before he put pen to paper and wrote this particular essay called Search for a New Principle, where he actually wrote down similiba similibus currentur. So he asks in this, but he asks a lot. This is a very interesting essay. He asks a lot of very interesting questions. But one of the questions he asks the Socratic question, perhaps, however, botanical affinity, in other words, remedies that are in the same botanical grouping, may allow us to infer a similarity of action. And then he says this is far from being the case, as there are many examples of opposite or at least very different powers in one and the same family of plants, and that in most of them. He then says we shall take as a basis the most perfect natural system, that of Murray, and then in good Hahnemannian style, he gives you like 5 pages of examples of remedies that are in the same grouping, same botanical grouping, but have different and sometimes even opposite medicinal properties. Continuing in this essay, Hahnemann writes, I am far from denying, however, the many important hints the natural system, like the system Linnaeus had developed, right, may afford to the philosophical student of the material medicals. He's saying, listen, there can be hints in the natural systems that we group plants and animals together by. This does have some interesting information in it. Okay, and it might be useful to the philosophical student of the materia medica and to him who feels it is his duty to discover new medicinal agents. But then he says, but these hints can only help to confirm and serve as a commentary to facts already known. And what he means by facts already known are remedies that have had provings conducted on them. In other words, the remedy was given to a healthy person so we could see which symptoms it produces, so we know what types of conditions we're going to give that remedy for, or that have symptoms that have been discovered during clinical practice that we know are associated with that specific remedy. So help to confirm and serve as a commentary to facts already known, the symptoms we actually know are real for that remedy, or in the case of untried plants, ones that have not been proven or for which we don't have clinical experience, they may give rise to hypothetical conjectures, which are, however, far from approaching even to probability. And then finally, he writes, though I readily admit that, in general, similarity of action will be much oftener met with betwixt species of one genus. In other words, he's saying that if the remedy is in the same botanical grouping, yes, it's more likely that there will be similarities of medicinal action if it's in that same grouping than betwixt whole groups of families in the natural system than other groupings, okay? And that an inference drawn from the former will have a much greater degree of probability attaching to it than from one from the latter. So in other words, there is some truth to that, the fact that remedies can be in the same grouping and they can have similar medicinal properties. Yet my conviction compels me to give this warning, that be the number of genera ever so many whose species resemble each other very much in their effects, the lesser number of very differently acting species should make us distrustful of this mode of drawing inferences. So he's saying be careful, because even though remedies that are in the same grouping may have similar actions, there may be some in this particular grouping which have very different presentations in practice that produce very different types of symptoms. Now, when we look at Hahnemann's description of Ignatia in Materia Medica Pura, now Ignatia, Dr. Fleischer mentioned, is a member of the Loganacea family, along with the remedy that he prescribed, the Huang and Nux vomica, and many other remedies as well. And in this description of Ignatia, Hahnemann writes, its positive effects have a great resemblance to those of Nux vomica, which of course is in the same botanical family, the Loganacea, which indeed might be inferred from the botanical relationship of these two plants. So Hahnemann is now saying, hey, these two remedies are similar because they're in the same botanical grouping. So this is very interesting. He's admitting that there is some value in looking at groupings of remedies in practice. So you got to be careful about it, but there is some value in this. So how can we better understand this? Let's take the example of the Solanaceae grouping, or the nightshade remedies, okay? If you look at certain nightshade remedies, certain Solanaceae, like, for example, belladonna here, you can see the blackberries there, which correspond to the dilated pupils. Belladonna, of course, means beautiful woman. During the Renaissance times, women would actually ingest small amounts to make their pupils dilate, which made them feel more attractive to others. So
They use eye
belladonna,
drops.
what's that?
They actually used eye drops.
Yeah, they use eye drops, exactly. Yeah.
Yeah.
So belladonna, beautiful woman, is a remedy that produces very maniacal types of symptoms, all kinds of fears, fear of the dark and fear of dogs and fear of water and convulsions and manias. And, it's a wild type of crazy type of remedy. It's a remedy you could think of for states of insanity. And that's also true for the remedy hyoscyamus. That's another remedy that we could think of for maniacal states. So people throwing off their clothes and playing with feces and being very foolish and ridiculous, but completely crazy and insane with a desire to escape or be extremely violent. And the same thing for stramonium, Stramonium datura, stramonium. We find all kinds of maniacal states, and it's another name for stramonium is Jimson weed, because in the early colonies in the Americas, the Jamestown colony, they accidentally the locals actually ate some stramonium. They didn't realize what it was, and for the next 24 hours, they took off all their clothes and ran around the compound barking like dogs. And so they gave it the name Jimson weed from Jamestown. But
Right.
again, you're going to produce.
Also called loco weed.
Yeah, exactly. You produce these maniacal states, craziness, really out there. And the same thing for another Solanacea called Mandragora. So all of these Solanaceas are actually quite similar. They all produce very similar types of symptoms, convulsions and dilated pupils and fears and desire to escape and violence and all kinds of very similar types of qualities. And the reason for this is that these particular solanaceas contain similar alkaloids. They all contain atropine, they all contain hyoscyamine, they all contain scopolamine. And these particular alkaloids are the psychotropic alkaloids in these particular plants that produce these maniacal, crazy types of states. But other members of the nightshade, other members of the Solanacea family, like tomatoes, like a persicum, and eggplants, and potatoes, Solanum tuberosum, and peppers, capsicum, or tobacum, you don't, when you eat a tomato or a baked potato or some, stuffed eggplant or, eggplant parmesan, you don't expect in the next few hours to be ripping off your clothes, running around the house, screaming like a madman, and with violent impulses and a desire to escape life altogether. No, that doesn't happen because these particular nightshades do not contain those particular alkaloids, the atropine, the hyoscyamine, the scopolamine. And because they don't contain these alkaloids, they don't produce these types of medicinal effects. So we can see that in some cases, the nightshades can be very similar, and in some cases they can be very different. And this is you'll find this to be quite true for most of the groupings out there. You look at the Apiaceae, and you've got very poison examples like Canaia maculata, or Cicuta virosa, or Ethusa sinapium, or Onananthes crocata. But then you've also got ones like Petroselinum or asafoetida, which are culinary herbs that are used in dietary preparations. So again, some are very poisonous, that have poisonous components, some are not. And depending on the grouping, there may be more or less variation within that particular grouping. For example, in the snake remedies, especially the Xenophidia snakes, which is the most evolutionarily advanced of the snakes, those are the ones that actually produce a venom. Those particular snakes tend to be quite similar. There are some variations. Nausea does not cause the bleeding that the other snake venoms tend to produce. It causes more asphyxiation and cardiac arrest. But most of the other snake venoms, the Xenophidia snakes, they produce venoms that cause hemorrhagic diathesis, bleeding. They cause an action on the sympathetic nervous system. That's why you see the fight or flight responses so common in the snake remedies. But again, it's based on the chemical composition of the venom and its effect on the prey, and that's how we determine whether the remedy is similar, and not based on the fact that it's in a particular grouping. Yes, the fact that it's in a particular grouping could make it so that it has similar chemical compositions, but that's not always the case. So we have to differentiate between the toxic and non-toxic solanaceas in homeopathy. And we also have to, in general, when we're looking at groupings, identify those that may be different or have different characteristics than the other members. And you can see this, like in the acid remedies. There are certain acid remedies like gallicum acidum or fluoricum acidum, which are quite different from the other acids. Most acid remedies tend to be very, very chilly and weak. Fluoricum acidum tends to be more warm and has more increased strength. So there's differences between each of them. Some groupings tend to be very, very similar. For example, the lac family, the milk groupings. And the reason for that is because even though the amount of composition of various components will vary, the components will be very similar. They all have fat, they all have the lactose sugar, they all have the protein. So they will have a lot of the similar compositions. Yes, delphinum, dolphin milk will have much more fat, but the composition will be very similar. And therefore, what you tend to see in the milk grouping is much more similarity among the different members. This information can be invaluable to you in practice because there will be cases where you want to give a particular remedy, but that remedy doesn't fit perfectly. I can think of a case from Dr. Will Taylor where the person had taken pulsatilla in the same potency over and over and over again, 30C, and ended up proving pulsatilla and ended up getting amenorrhea. So they were not menstruating any longer. And when you repertoire the symptoms of the case, what you noticed is that a lot of ranunculicids, pulsatilla, staphysagria, ranunculus bulbosus, helleborus, a lot of those were coming up high in the aconite were coming up high in the repertorization. And so what a lot of the homeopathic software tools allow you to do is to limit your analysis to a particular grouping. And so when you limit it to just the ranunculicids and looked down the list, there was one called Aquilegia vulgaris, columbine flower. And when you went and read the Materia Medica, it fit the case perfectly. Dr. Taylor gave the remedy and it produced a wonderful resolution of the situation. So this information can be extremely valuable, but you've also got to be careful about it as well, because if you try to find a grouping first, and you say it's got to be in this grouping and you exclude every other possibility, you may miss a very, very obvious choice. And a good example of this is a case from Adolf Lippe that was published in the International Hahnemannian Association Transactions, where the person was convulsing and very fearful and violent and biting. And every time they heard water or saw a mirror, they would go crazy and wild. And for people who are looking for a grouping first, they look at that constellation of symptoms and they say, oh, this person needs a solanaceae, because those symptoms do fit some of the nightshade remedies like belladonna and stramonium and hyoscyamus. Some people say Lycinum hydrophobianum, which is the remedy made from rabies, as a possible choice. But in this particular case by Lippe, the actual correct remedy was the remedy Cantharis vesicatoria, Spanish fly. And the reason for that is because the condition would always come on when she would begin to urinate. That concomitant of urination would bring on that state. And that state can also be found in Cantharis, just the way it can be found in some of those nightshade remedies. So that's an example of how you could put on blinders and not see any other possible choice because you're only looking at the grouping. So the grouping can have great value, as you saw from the case that Dr. Fleischer presented, where he was able to use this information to great utility. He tried first to address it through normal Hahnemannian approach, repertorizing the case, but he wasn't able to do that. And so, like all of us, the bottom line is we want to help our patients. We want to help the people who we're working with. And we're going to do everything we can, including, stepping outside of the box and considering other possibilities when the approach that we're using is not seeming to produce the results that we want. Here's a representation of the ranunculiciid remedies, and I pulled this up here just to give you another example. Here, this is interesting because if you actually look at these ranunculiciids, a lot of them look very different. Pulsatilla and aconite really don't look all that similar. Staphylos aureus doesn't look very much like aconite or Helleborus. So you can see that in this particular grouping, there's more, in my opinion, more variation than you'll find in a lot of other groupings out there. And also, it's very interesting that just because there's a remedy that's not in a particular grouping doesn't mean that that remedy couldn't produce medicinal effects similar to another remedy that's completely unrelated to. And a good example of this is the is Helleborus. Helleborus, which is the ranunculiciid family, contains a chemical called hellebrine, which is very similar to a chemical that's found in the common toad. And therefore, there can be certain similar effects from Helleborus as from the common toad. And obviously, these are not only not in the same botanical grouping, they're not even in the same kingdom. One's an animal and one is a plant. So again, just because something is not in a particular grouping doesn't mean that it couldn't produce similar medicinal effects. The reason for this is that the evolutionary phylogenetic relationship of organisms in the natural system is not the only determinant of the medicinal properties of those organisms. The environment also has a part to play. So a particular organism, it could be a plant, an animal, it could be a fungus, whatever it is, living in a particular environment may produce certain structures and chemicals to contend with the environmental stresses that it is dealing with. And because of that, it may be evolutionary phylogenetically unrelated, but have similar medicinal effects because it's coming from a similar environment. A good example of this is gymnosperms and angiosperms. Gymnosperms are cone-bearing or non-flowering plants, and angiosperms are flowering plants. Well, angiosperms and gymnosperms divided evolutionarily hundreds of millions of years ago. So they're not related phylogenetically. They divided a long time ago, and yet both gymnosperms are trees, conifers and things of that nature, and our flowering plants both produce trees. Treeness is a technology to contend with certain environmental conditions. And so the environment also plays a part to play outside of the phylogenetic evolutionary groupings that we can put these various organisms into. All right, so those are my quick comments. Um, for each of these sessions, I'm going to be, after the person does a particular presentation, I'm going to be doing a small remedy. I want to just quickly mention that there will be a number of other sessions. Please try to participate in as many of these sessions as you can. Of course, they are recorded. Our other guest speakers include Gabrielle Traub, Duncan Hurd, Shauna Kalika, Andrew Chambers, Alex Mello, and Annalisa Percy. And these sessions will be running on January 26th, February 9th, well, January 6th is today, February 9th, February 23rd, 28th, March 9th, March 23rd, April 13th, April 27th, and May 11th. Try to participate in the live sessions because there will be lots of opportunities for questions and answers and your participation and discussion about the various cases that we go through, as well as the presentations that I do. And the slides will all be posted up on our website for people to review. And we hope that you'll attend as many of these as possible. If you can't attend one live, they will be recorded and available for later viewing. All right. So, yeah. So I'm going to do a small remedy. A small remedy is not one that's small in nature. A small remedy is one that's small because it's not particularly well represented in our literature. It's not found in a lot of rubrics in the repertories that we use to cross symptoms to find the appropriate remedy for a particular individual. And it's not particularly well represented in our materia medicas, which is the description of all the symptoms of the remedies that we use in practice. So the first question is, what is the most overrepresented remedy in our materia medica?
Sulfur.
And well, sulfur is the most represented, but the most overrepresented is actually, in my opinion, lachesis. Yes, sulfur is the most represented, no question about it. But the most overrepresented is lachesis. And the reason for this is because lachesis was proven by Constantine Herring when he was living in Suriname in South America on July 28th, 1828. And it was a fairly good proving, but after that particular proving in 1828, there weren't the next remedy, snake remedy that was proven was Crotalus horridus. It wasn't a very complete proving, and there weren't really any other really excellent snake provings that came in for a very long period of time. And so what would happen is somebody would come in with certain symptoms, which were, of course, associated with lachesis, but were also found in other snake remedies, like feeling forsaken, delusions that someone is behind you, protruding your tongue, hemorrhagic diathesis, fight or flight responses, issues with family members. These are all symptoms. Can't have your throat touched. These are all symptoms that we associate not just with lachesis, but with the snake remedies. And what would happen is somebody would come in and maybe they would need another one of the snake remedies like Crotalus horridus or Cerast or Dendroapis polyepsis or Crotalus cascavella. But those remedies weren't well enough known. They didn't have complete provings or hadn't even been proven yet. And there were enough symptoms there to give lachesis. And remember, there's more than one remedy that can move a case forward in a positive direction. We give not similimums, but close enougicums. And so they give lachesis, and yes, lachesis would work. It maybe wouldn't completely resolve the situation, but certain symptoms would go away. And those symptoms would then be added to the materia medica of lachesis, and then lachesis would be added to all the rubrics in the repertory for that particular symptom. And consequently, lachesis became overrepresented in our literature. And the reason this is important is that when you do a repertorization, and lachesis comes up, it doesn't mean that you necessarily need lachesis. You have to, in these situations, look at the other snake remedies because there may be one which better fits the totality of characteristic symptoms of the client you're working with. All right, so the remedy I want to talk about just briefly is Crataegus oxyacantha, hawthorn berries. I am fortunate to have a tree in my backyard in the spring when it flowers. The bees go wild. I mean, it's just, you can't even get close to the tree. The bees love it so much. And this is a wonderful berry that is a wonderful tonic for the heart. You can use it, it's an herbal preparation that you can use in tincture or even as a tea, but you can also use it homeopathically based on the symptom pattern. It affects the heart and the nerves primarily, causes lots of palpitations, all kinds of cardiovascular issues. And you're going to have to compare with other remedies that you think of for cardiovascular problems like nausea and Latrodectus mactans and Spigalia and Cactus grandiflorus and Strophanthus. These are other remedies that have a very strong affinity for the heart that also have to be compared with Crataegus to see how it's both similar and different. Great remedy for valvular deficiencies or hypertrophy, where the patient has difficulty breathing and edema, so there's lots of swelling. The pulse is gradually growing weak and also can be very rapid as well. And these people are they're almost resigned to the fact that they're not going to survive the situation. Very important remedy for fatty degeneration of the heart with difficulty in breathing on the least exertion. The heart can get very, very large. There's anemia and swelling and edema. Uh, Heart failure is very common during acute infectious diseases in this remedy. So it's one of the top remedies I think of for heart failure during an acute infectious disease. It's indicated when the heart is dilated and the sound of the first beat is weak. And oftentimes with Crataegus oxyacantha, you'll find murmurs, angina pectoris. So you'll want to compare it with remedies like nausea and Latrodectus, smactins. You can also have accelerated and irregular pulse. So you want to compare this with a remedy like digitalis. One of the major features that you see in Crataegus is the patient is weak and exhausted, and the weakness comes on very suddenly. You can see it's listed here and is the only remedy for excessive weakness accompanied by chronic complaints of the heart. Obviously, this is an incomplete rubric. There would be other remedies to consider, but it does demonstrate the importance of this symptom for this remedy. You can think of arteriosclerosis with high blood pressure in this remedy. Sometimes even idiopathic high blood pressure where you don't know where the blood pressure comes from. It also can be used for a collapsed state of typhoid fever where there's hemorrhaging from the bowels. These people definitely they can kind of look like carbo veg. They need air. They're kind of giddy. The pulse is lowered. The blood pressure tends to go down. There'll be all of these types of things. You'll see edema, chilliness, anemia. Very important. Oftentimes, the Crataegus oxyacantha patient will have insomnia. I mentioned this before, very feeble and irregular heartbeat with cold extremities, a pale face, irregular pulse, and irregular breathing. So things are irregular in Crataegus oxyacantha. One very peculiar symptom that came out in the proving is you won't see this ever in your life, but if you do, think of Crataegus oxyacantha, and that is a painful sensation of pressure in the left side of the chest below the clavicle. Only one remedy listed in our repertoire for that particular symptom. Now, this is important. These are irritable patients. The one case where I had Crataegus, wonderful successful. It wasn't the only remedy I gave. I'd given a number of other remedies, but Crataegus is the remedy that ended up completely resolving the situation. And the reason I gave it was because the patient became so incredibly irritable, like really, 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 really irritable, and very, very anxious as well with this headache that's very characteristic of Crataegus. And he did remarkably well with this particular remedy. Here you can see they're very anxious with pains in the back of the head and neck, and they can also sometimes have stomach problems. You can see it's in the rubric restlessness, the headache when the occiput in the neck during a headache when the occiput in the neck. They can have ailments from grief. The case, interestingly enough, the case where I gave Crataegus oxyacantha was a case where the individual had had a major grief. His intimate partner of many years had left him, and this ended up being a very, very good remedy for him. Now, Fatak mentions it as a remedy for diabetes mellitus in children, and in some of the books, it also says it's a remedy for diabetes insipidus. That seems kind of bizarre to me because these are not really the same condition at all. Diabetes mellitus is a problem. Well, there's different reasons you can have it, but basically, it's a problem where you can't get the sugar out of your bloodstream. Diabetes insipidus is a problem of the posterior pituitary gland that causes excessive urination. So these are really very different conditions, and I would want to investigate that further about whether Crataegus is actually indicated for diabetes insipidus or not. One important modality in Crataegus, which will help you to differentiate it from other cardiovascular remedies, is worse in a warm room, and also they're aggravated by any exertion or excitement. But that warm room aggravation is a really important one. They're much better in fresh air, and they're better when they're left alone they really want to be left alone to just rest. They're very irritable and they want to be left alone. That's what you will see in Crataegus oxyacantha. They're so irritable that they can actually have a disposition to be contradictory, and they're intolerant of contradiction. So, this can make you think of remedies like Nux vomica, irritable, contradictory. But Aurum is a heart remedy that can be have uh, indisposition, the intolerance of contradiction. Now, Crataegus, if you look at the literature in our Materia Medicas, this is a remedy that's you can give it in potency. You can give it in low potency, 6x, 3x, 6C, but it's also recommended in tincture as well. And if you're going to use the tincture, I recommend using, depending on the person, their weight, their age, anywhere between about 1 to 2 to up to maybe 15 drops at the most. It takes a period of time, usually a week to 10 days before you start to notice improvement. The energy picks up, they feel less irritable, things of that nature. But you do need to be careful. You can't continue this indefinitely, especially if you're using it as a tincture. You're going to want to reduce it and probably not continue for more than maybe 6 to 8 weeks at the very most. All right. So we don't have too much time. We've only got a couple of minutes. I'm going to stop sharing and I will address any questions that anybody has for Dr. Fleischer or myself. We've only got a couple of minutes. Oh, here somebody says from Piers, uh, uh, Piers said it's also in Chinese medicine good for the digestive system as well. All right. All right. Boy, these I can barely read these questions. They're so like lengthy and they're like in one line. Mitch, we've only got 1 minute left. Mitch, do you want to, in these future sessions, we'll give more time for Q&A. Do you have any final words you want to share with anybody? We're very fortunate to have Dr. Fleischer in our community and in our profession. He's got a heart of gold. He's a man who's seriously interested in really helping his patients, and his patients love him for that very reason. And plus, he's incredibly, incredibly knowledgeable.
Well, Kim, I would just recommend that people remain open-minded. There's more than one way to skin a cat. You know,
Totally.
one of my mentors, Dr. Bill Gray, who's considered the father of the Renaissance of homeopathy in America, after studying with Altocus, he would always tell me, when you have a difficult case, you can't figure it out, if you have to, cheat.
I love it.
And
Uh,
yeah, there's a lot of weaving back and forth with remedies, and it's so nice. Well, it's some of the new programmings that are happening that that we can finally fit one together. I had a great case um, of someone who had calzalgia, which is reflex symptomatic dystrophy. Is that
yeah.
condition where someone gets an exquisitely painful limb from a cast or from an injury, and they have vasomotor instability with heat and cold, and it's terrible. And some people have their limbs cut off because they're in so much pain.
Oh,
It doesn't work. But this person responded. They've been completely, virtually bedridden for 4 years after an injury. And after a single dose of Nux vomica 1M, they were out running again 5 miles a day 4 days later after the dose. And then,
amazing.
interestingly, over the course of about every 4 to 6 months, they'd go into this profoundly sleepy state where they'd just collapse. They'd be ironing and they would start getting sleepy and walk towards the couch, collapse and crawl and fall asleep. So they went from needing Nux vomica, Nux machata, Nux vomica, Nux machata over a course of about almost a decade. And
Mm.
they would feel great for from one to the next. And I said, this is crazy. Went from one Nux to another. And they're completely unrelated remedies. One is Nux machata, which is nutmeg. The other was Strychnos Nux vomica, completely different families. And it wasn't until they went into this completely negative, aggravated state where they felt hated by everybody and hated everybody. I did a deep search and found a newly proven remedy, heroinum, homeopathic heroin, that fit both Nux Majada and Nux Vomica beautifully, and it dramatically cured this person.
Fantastic. Excellent. Well, thank you, Mitch. Really appreciate your expertise and your wisdom, intelligence. Thank you, everybody, for your participation. I hope you'll join us for future sessions. We're really excited about doing this series. We'd like to continue this and help people understand really how we can practice homeopathy to the greatest success. Blessings to you all. Thank you, everyone. Thanks, Mitch. Talk to everybody soon. Take care,
God
everybody.
bless.
Bye bye.